Hi everybody, my name is Joshua Goldstein, licensed acupuncturist, Chinese medicine practitioner here in Ridgewood, New Jersey, and today we're talking about super stressful people and Chinese medicine. Super stressful people represent a greater challenge than people who deal with generalized anxiety disorder because they're literally super stressed. They go about their day with an animus or a drive that keeps them on a merry-go-round, basically like a roller coaster of emotional ups and downs and stresses. And it's almost like they're driven by some hidden animus that they can't stop. So these people will be very busy. They'll talk fast, they'll walk fast, they'll suffer from digestive problems. They'll have very tight muscles in the neck, the shoulders, the back. They may suffer from headaches, but they certainly will have some sort of somatic physical problem that they're dealing with. In addition to the physical, they'll also have trouble sleeping. They'll also have trouble with patience. In fact, the word patience doesn't exist in their vocabulary because everything has to be done fast to match the pattern of the state that they're in. And so these people could be up for hours. There's always deadlines and things that have to get done, and they all have to get done at one point. And it's essentially like they're possessed with stress that they can't stop, and they feel compelled to continue. Generally, anxiety is characterized by feelings of worry, anxiety, or fear that they can't do certain things. But with people who are super stressed, they're not inhibited by these things. They just propel themselves and go further and further and further. They also go through periods where they're very active, and then they go through periods where they're very tired, and they fight that. They feel that they can't rest for any reason. Now, there are many medications that people can take that they use to treat this. There's antidepressants, there's Buspar, for example, there's benzodiazepines. They help basically as sedatives, and they affect certain receptor sites called GABA A receptors, and they try to make a calming effect. And examples of these are Xanax, Klonopin, Ativan, Valium, Librium, Versed, and Halcyon. In Chinese medicine, the definition of anxiety mirrors the same as Western medicine, but they also have other symptoms such as worry, anxiety, intense fear, OCD, panic attacks, PTSD. So they're kind of lumped together as opposed to being separate categories. Now in Chinese medicine, the main condition that causes people to feel super stressed is the fact that it's related to a circulatory problem, mostly related to the heart. Most people have blood flow to the heart, but if it is not optimal, meaning that you're not having an optimal amount of oxygenated blood flowing through the heart wall, then you're going to have less oxygen going to the brain, and on some respect, you're going to feel as if you're being choked to death on a very small, minute level. Imagine if you're being choked like this, after a minute, you're going to start to feel it and start to panic. It's almost as if these people have run out of breath underwater and they can't get up fast enough to catch another breath, except they never get to the top. So they're always in that frightened state. And I think that image really nails it. So in Chinese medicine, we look at the blood flow, at highly oxygenated blood flow throughout the body, has to be at a very high level, and we don't necessarily have a test that can show that. Yes, you can check peripheral blood flow in the fingertips, but it doesn't necessarily show what's going on and getting into the heart wall of the heart itself, or the other organs for that example, for that matter. And so you can go around feeling quote unquote healthy and pass all your tests and be healthy because you're not sick enough to trip a test. However, that doesn't necessarily mean that you're feeling healthy enough to function properly. So when I talk about this, I want you to separate the idea of disease process, where they can actually find a defined disease organically in the organ, which means you've slipped down to a certain point of dysfunction that now can trip a test and show that dysfunction. And on the other side, how well are you functioning? And that's a question that they really can't answer in a medical field. They can only look at how bad you're functioning, or if you're bad enough yet to warrant medication or other type of treatments. But they don't have what's called function. How much oxygen do you need for function? Well, some people need a lot more than others, and so you can run into trouble. So people who are super stressed are having suboptimal oxygenated blood going to the heart. And in Chinese medicine, we use acupuncture to stimulate blood flow to the cardiac artery to help stimulate more blood flow so they could feel more relaxed. And we also try to dismantle the problem, and we have pretty specific protocols that we use within Chinese medicine, which is the use of medicinal substances found from certain plants, from roots, barks, leaves, and even some animal substances in some cases that can be used to help get more oxygenated blood to the heart so that you could feel calmer and feel more relaxed. Now, anxiety can have a very big stigma to it, despite all the attention given to it, despite everything written about it, despite all the help groups out there. But most people think there's something wrong with them. And so the tendency is to treat people in the medical field with a lot of sympathy. And they basically label you as anxious, and then they just treat you with sympathy, and they don't necessarily listen to you, really listen to you. Therapists do a great job of listening to you, but once you're labeled anxiety in the medical field, you're just given medication and sent off on your way. Well, I want to tell you that you weren't born anxious, so there has to be a physiological cause for why you're anxious. They still cannot answer why you feel anxious. Yes, they can point to a certain event. They can point to a certain specific traumatic experience, which can bring that on in some cases. But for the most case, they can't really explain why that persists, why that gets grooved into your system, why that continues to occur. So we believe in Chinese medicine, if you can fix the organ, you can then fix the mental function, because physiological blood flow is needed in order to get that oxygenated blood. And so in the case of super anxious people, I can't cure all of them, but I do find that I can get their anxiety down to much more normal, and I would like to use the word livable levels. If you or a loved one are dealing with anxiety and you would like to explore this more, I invite you to come in or speak to me on the phone where we can talk about your specific case. I'm here in Ridgewood, New Jersey, and my name is Joshua Goldstein. Thank you so much for watching.